Over the last 25 years, I've had the privilege of interviewing and highlighting some truly interesting people. Everyone who is anyone, both the famous and the infamous, from presidents and their first ladies to kings and queens, movie stars and pop stars, heads of industry, heads of state, sports personalities, innovative entrepreneurs, and some pretty fascinating everyday people. Today, I'd like to introduce you to Cynthia Shechter, a comprehensive oncology rehabilitation expert who is dedicated to treating patients as people, not conditions. Cynthia, it's such a pleasure to talk to you, and someone who has been involved with the healthcare system for many, many decades. I want to say I appreciate your dedication to patients. What made you decide to dedicate your career to occupational therapy?
It's actually interesting. I really thought that I would be a social worker my whole life. That was sort of my goal. I wanted to go and help people who needed help. My parents actually met an occupational therapist on a vacation that they went on and told me to look into it. And in undergrad, I went and I volunteered at Tompkins Community Hospital in Ithaca, New York. And I volunteered in their outpatient program working as an OT assistant. And it was probably the most interesting, valuable experience of my life. And it completely changed where my trajectory was going to go. So although I was still a clinical sociology major in undergrad, I had a new goal that when I graduated, I was definitely going to graduate school to become an OT, because it was so much more all integrated. So you could work with people not only on the things that you would work with them on with social work, but you could work with them on their functional tasks and being able to do things in a way that might have been different than they did before their injury, but that would allow them to be an independent existing person and never have to feel as though they depend on others, because that's usually what kind of gets us all down. So it was an awesome switch. And then I continued on my way.
That makes complete sense. And especially for somebody like me, you don't know my health history. I'm a heart disease survivor. So I like to tell everybody that open heart surgery saved my life 12 years ago, but rehabilitation, cardiac rehabilitation, is what gave me my life back. So I probably could be the poster child for what you're talking about. Am I right?
Patients don't even know that there are specialists out there who can help them through their journey. But there are so many limitations that you have, as you would know from an open heart surgery. Even just scar tissue alone, it changes the way that you hold your body. It changes the way that you move, and then you're stuck.
And rehabilitation really and truly gave me my confidence back. That's something that people don't put as much emphasis on, but being able to have your confidence back that you really can live a full life, I think is what you all give people.
Yes.
So that brings me to you. What is some of your personal philosophies with regard to patient care?
I truly believe in treating an individual. So I think that where rehab goes wrong is when we treat a condition. So like after breast cancer surgery, a lot of people have an experience with lymphedema. Lymphedema is a swelling condition, and it is treatable, manageable, but not curable as of now. When people have lymphedema, they are often taught to live for the dysfunction. So they're taught all the things that they have to do on a daily basis in order to manage their swelling condition. But do they have to do everything? I don't believe so. I think that, we all have to look at our lives and see what we're actually able to do and able to integrate into our daily lifestyle.
Cynthia, I understand you have a particular focus on rehabilitation to recover from breast cancer surgery. As you pointed out, there are some unique challenges. Can you explain a little further what unique challenge does the recovery of this kind actually entail, and how do you work with the patients to overcome some of those challenges?
Initially, if you see a patient post-operatively, you want to work on preventing lymphedema, as it is a chronic condition. So lymphedema, for those who don't know, is a swelling condition that can happen after you have lymph nodes removed, which happens quite often with breast cancer. Lymph nodes are generally directly in connection with where your tumor is, and it kind of dictates the way that your care goes, if your nodes are involved versus not involved. But even a sentinel node biopsy, which is a tiny biopsy of a lymph node, can cause lymphedema. And I have plenty of patients who had the sentinel node biopsy and ended up with a dysfunction. But it's not only lymphedema that happens post breast cancer. And I think, generally speaking, if we look at the medical profession, they sort of wait until somebody's arm is actually swollen to send them for rehabilitation. And there are so many things that a rehab therapist can work on with a person during the period of time of recovery. So even 2 to 3 weeks post-op, they have scar tissue. You had basically an amputation of your breasts. You have reconstruction. You have reconstruction that interrupts the function of the muscles in your chest wall. You have incision sites under your arms, which makes it very difficult to raise your arm overhead, so that you end up stuck and you can only do this. And then you're told not to lift more than 10 pounds, which is unfathomable for most of my patients, because actually patients now are so much younger. So they have young children, and all that they can think of is, well, if my 1-year-old falls off the slide, how do I pick them up? Do I have to bring someone with me? No, that's ridiculous. I have to make sure that your body is ready. But I think breast cancer in and of itself, you have so many different dysfunctions that can happen that it needs to be its own specialty.
It makes complete sense to me. My very best friend in the world, my friend of 33 years, was diagnosed with breast cancer and had to have a mastectomy. And it was an education for all of us. The emotional drama, then the actual physical surgery, and then the rehab. And
Yes.
And I don't think that enough people put credit in all of those different stages and levels when you get that diagnosis. And so I completely see why your focus is very patient driven in that regard. I can also see why you are very much involved in the Ask the Expert program.
Thank you.
Because you really do know what you're talking about. So why don't you share with me some of your experiences serving as an expert for the Ask the Expert program of Lymphatic Education and Research Network?
So it's interesting, actually. So I thought that it was going to be, honestly, I thought it was going to be people send in questions and I answer, right? That seemed to be, I mean, that sounds like it is what it is, right? They email me a question, I send them an answer, we're good. But then the questions are so much more than just a question. They're asking me about lifestyle changes. They're asking me about what their therapists have said, or they're asking me why they've never been sent to therapy and do they need to go. And to be honest, it's interesting because I don't know anyone. So as a clinician, I can't truly answer individual questions about what they should do, but I can guide them because I've never met them. But I can't tell you how many times I go to answer a question and it turns into a Zoom that I don't mind doing, because I'd rather be able to speak to a person and see what's happening than actually just give them a blanket answer that doesn't really cover what they want. And by other medical professionals, I've been warned that you give too much information, Cynthia, you're going to put yourself at risk. I'm like, what am I putting myself at risk for? All that I'm doing is helping people.
Yes.
And I think that that explains what's happened to the whole healthcare profession overall. I mean, I think that we should answer people's questions. I think that it's important that we understand what each person is going through.
You really have taken advocating for others to another level, Cynthia. And so personally, how do you take care of yourself? I know that you recently lost your mother, and being someone who is a woman who lost her mother 4.5 years ago, it left me with a real hole. But I like to tell people my mother taught me everything I needed to know except how to do without her. What about you and your mom?
It's interesting. So my mother just passed. She passed away on Saturday.
Oh
So
my gosh, I'm so sorry to hear that.
thank you. It's very fresh. It was a bit of a terrible experience. My mom actually had 2 stage 4 cancers.
Mm.
And up until Monday last week, she was walking, she was talking, she was going out to lunch with her friends, and she was enjoying herself. And then on Monday, everything shut down.
Ah,
And it was all a very big rush. But my father also died when I was 21, and he was also a huge influence on my life. At 21, I had just graduated from undergrad. So it was interesting because all of my friends were going out and finding their careers and their jobs and going to grad school. And I was lost, honestly. So I actually had I had applications out for grad school, but I withdrew them to make sure that I could be there for my mom, because I didn't want to go anywhere. So I stayed. And then now my mom died, and I'm like, oh my God, I'm 49 years old and I'm an orphan. And I don't think that a 49-year-old, you're supposed to look at yourself as one, but it's that parental guidance or just support and love that you don't know what to do without. Like I had this interview with you, and I know my mother was very excited that I was going to do it. And I know that she'd be very proud of me, but isn't it something? She'll never see it.
I feel that her presence will be with you. You know, it's the only thing that has really gotten me through these 4 years. I have a sister, and my sister and I have become much closer. We were great friends, and now we're even better friends. And Cynthia, I'll share this with you. I remember when I was eulogizing my mother, and I got it. I said the words, you know, my mom would be very proud of the fact that my sister and I have really bonded this week and put everything in place for her homegoing, and there have been no issues and no problems. And Cynthia, I swear an oath to you, I could hear my mother as I stood in that church say to me in my ear, "You don't get credit for things you're supposed to do." I could literally hear her say that. And I said it out loud, and the whole church just burst into laughter because they all knew my mother.
Yes.
I believe very strongly that your mom's influence, she said, "Girl, get your butt to that interview. This is something you've been looking forward to." And more importantly, what you're talking about is going to influence other people. You're going to help other people. And that's what your mom inspired you to do, what your dad inspired you to do. So
yes,
you're doing what you're supposed to do. I'm sending you prayers.
Thank you.
And for you and for your sister. And I'm thanking you on, behalf of really grateful patients for all of the things and the advocacy that you do. I'm curious. I know that you have a number of projects and stuff that you've been working on, but as we've talked about illnesses and effects on patients, I'm wondering, how did the COVID-19 pandemic affect your practice? Because you talked about hospice and some of the supply chain challenges. I'm wondering if you experienced a decline in the way services were provided coming out of the pandemic.
COVID definitely affected the practice. It affected me, but you know what? It also taught me that there's a lot that you can do even when you can't get there.
Mm-hmm. And that brings me to your motto, because you talked about raise your arms. Your motto is raise your arms high and live without limits.
Exactly.
Talk to me about that.
So in lymphedema therapy, there are a lot of limitations set. There are a lot of limitations set after breast cancer surgery, depending on who your doctor is. The more old school doctors will certainly say, don't, lift more than 10 pounds for the rest of your life. Some other people might refer you for therapy. But generally speaking, I think every single person who goes through breast cancer treatment needs to be able to raise their arms over their head and be proud. So even if you're at a game and you want to do the stupid arm thing that they're doing, they do the wave, whatever, your arms should go up as high as everybody else's without a problem. And if you have lymphedema and you have an event and you're all dressed up and you don't want to wear a sleeve, you shouldn't have to. And the idea is that you need to know how your body reacts to something and then change the way in which you do something so that you have something else to do. So for example, if you have a tendency to swell when you don't wear a garment, then what are you going to do when you go home? Well, you could go on a vasopneumatic pump and you could do self-bandaging or use a nighttime garment. And by the time you wake up in the morning, you'll look great. And then you didn't have to miss and you didn't have to wear, I always feel like the sleeve and the glove, it's like your badge of breast cancer. And nobody wants to wear their badge of breast cancer because you walk out the door and everybody knows you had it. So to me, the living without limits is both living without all the have-tos and also just living. I think we should all sort of find our place and then try to excel. So one of the things that I've become involved in most recently is actually the Academy of Oncology Nurse and Nurse Navigators. They put out Cure magazine and Conquer magazine. It's a wonderful organization where they're trying to actually get nurse navigators in every hospital because patients don't have the people to go to. And if every patient had a navigator, they could sort of help them find their way. They could speak to them. They could be their first line of support. Whereas if you're speaking to all of your physicians, you're sort of all over the place because every physician has their theory. So I think what I want to really do is also become a much more fierce advocate for patients and for patients getting rehabilitation. And I think that goes across all oncology. I also would love to start working with schools in creating a specialty program. There are specialty programs in OT for hand therapy and pediatrics that people do an extra clinical affiliation, but oncology is not included in that batch of choices.
My brain is ticking along here with what's your future is holding. Cynthia, our time is coming to an end, but I gotta tell you, you've had so many wonderful experiences that have formed the person that you are and the clinician that you are and the therapist that you are. Is there one experience that really has impacted on you and something that you'd like to share as we close out?
Yeah. So I had a patient who was a very lonely woman. She was lovely. She distanced from friends so that, they weren't over at her house all the time. She would go see them, but they wouldn't necessarily, she didn't want people coming to see her. She wanted to sort of own her social life. She was disconnected from her family, and she didn't have a healthcare proxy. So for physicians, it is a conflict of interest to be a healthcare proxy because they are doing life-saving things. But as a rehab therapist, you're really not limited at all as long as you're willing to do it and do it the right way. So I actually told her that I would be her proxy. She asked me. She's actually the only reason that I have this office because she named me in her estate. And initially I wanted to donate the money. And my husband said, "What did she want you to do?" And I said, she wanted me to open up my own office close to home because she wanted me to be there for my child. She wanted me to be there for you. And she didn't want my life to be all running. So my husband said, then you have to do it. So I built my office. I dedicated it to Barbara. Barbara was an amazing woman who I would say was listened to 50% of the time when she had a complaint because she complained all the time. And I always knew when her complaints were real and we would talk about them. And I could always figure out how to make her feel better and how to get her better. And every step of the way, even while she was in hospice, even while she was actively ill, I could still get her better. And what I realized in the whole experience was that I was the only person who did that. And I couldn't believe it. because there were social workers involved and physicians involved and case managers involved, and everybody was there. But Barbara, she was an interesting person who was difficult to understand, and she helped me become the person that I am now, because she taught me that you have to actually get through the weeds to get to the person. And to get through the weeds takes a lot of personal connection, a lot of time, and a lot of individual attention, which is what I give during my sessions. So it was almost that validation that, like, you know what? I can do this. There's no reason I can't have my own office. She's right. I should be close to home. I should be doing things with my child. I should be doing things with my husband. I shouldn't be commuting into the city every day. And I can take care of people because I get it. And that was Barbara taught me. I give her 100% credit, and I love her for it. And if it wasn't for that, I don't know what I would do.
Well, Miss Barbara, we dedicate this interview and this practice to you and all the lessons that you taught Cynthia. And you know what? Let's just give a shout out to the strong women who came before us, because we really probably would not be able to walk on the path that we walk without them. So,
agreed.
Cynthia, thank you so very much for your time today. I really wish you the very best in your practice, and my thoughts and prayers are with you and your family during this very difficult time, and I'm sending you comforting mercies as you and your sister step into this next phase of your life.
Thank you so much, and thank you so much for taking the time to speak with me. This was lovely.
It was lovely. Thank you.
Thank you.